That tiny white pill is given to you by your doctor, who promises it will help regulate your blood sugar. The most commonly given drug for diabetes worldwide is metformin, but what if I told you that there is more to this story? What if I told you that metformin is a miracle drug with side effects that no one is discussing? I'm going to tell you what happens when you take it for years, and it could completely change the way you manage your health. The pharmaceutical industry doesn't want you to ask questions, and your doctor might not even be aware of the whole picture. The truth is that almost all newly diagnosed type 2 diabetics worldwide are prescribed metformin. Insurance will harass your doctor if you don't prescribe metformin because it's inexpensive, works for most people, and doctors give it out like candy. The problem is that they don't tell you that some people tolerate it well, while the majority have trouble with the side effects. They just tell you to deal with it. To be clear, I'm not saying that metformin doesn't work. It does activate AMP kinase in your cells, which helps your body process glucose more effectively. It can even improve your gut flora and cholesterol levels, but at what cost? Let's start with the obvious side effects that no one discusses. The stomach nightmare: gas, bloating, diarrhea, and abdominal pain. The majority of doctors will tell you that these side effects go away with time, but what if they don't? What if you are among the many patients who are still using the restroom 5 years after starting metformin? This is only the beginning. Serious B12 deficiencies are not a minor problem. When your blood levels of vitamin B12 decline, you may experience fatigue, brain fog, or even nerve damage that causes tingling in your hands and feet. The irony is that these symptoms can mimic diabetic neuropathy, so you and your doctor may blame your diabetes when your medication is the cause. Let's now discuss what happens to your kidneys after taking metformin for 5 years or longer. Metformin is eliminated by the kidneys, but if your kidney function deteriorates over time, which happens naturally as you age, metformin may build up in your system and possibly result in lactic acidosis, a rare but dangerous condition. Your liver is not immune either. Research indicates that long-term metformin use may cause stress to it, particularly if you already have liver problems or drink alcohol frequently. Keep in mind that the nerve disorders I previously discussed, such as peripheral neuropathy, can be exacerbated by long-term metformin use through B12 depletion in diabetes. Now, let's talk about the blind spot in our American medical system. I find it very frustrating that when patients who have been taking metformin for years suddenly experience fatigue or diarrhea, doctors rarely blame the medication. I've witnessed this happen numerous times. They say that you should look elsewhere for answers, but for later onset side effects, they're real. Your body changes, your tolerance changes, and sometimes the medication that seemed fine for years suddenly becomes a problem. The first thing you should do is to not panic and to not stop taking your medication without first talking to your doctor. So, what implications does this have for diabetes? Let's explore that. But first, a big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication, so if you're enjoying the content, please hit the like button, subscribe to our channel, and share your thoughts on diabetes in the comments. Your support truly helps us grow. Now, let's get back to the video. Of course, but do speak up for yourself. If you have been taking metformin for years, ask for a B12 test and think about taking 5,000 micrograms of B12 several times a week, preferably in liquid form, for better absorption. Probiotics like 100 billion daily can help with gut health, which is directly related to kidney health. Alpha-lipoic acid is one of the best antioxidants for diabetics, and Brent-amines offer antioxidant benefits that will shield your kidneys from ongoing oxidative stress. For liver protection, use milk thistle, which has been used for centuries to protect and detoxify the liver. Its active ingredients, such as slimmer, have strong anti-inflammatory and antioxidant qualities. Berberine, a plant compound, functions remarkably similarly to metformin. It enhances insulin sensitivity, activates the same amino acid pathway, and even lowers cholesterol, but it has fewer negative effects. Better yet, dihydroberberine is a more bioavailable version that virtually never causes gastrointestinal distress. The progression is similar to that of metformin, which has the most negative effects, followed by metformin, which has less side effects, and dihydroberberine, which has virtually no side effects. A combination strategy can also help some individuals reduce their dosage of metformin. If you're having trouble with the side effects of metformin, talk to your doctor about switching to extended-release metformin. This medication has 4 times fewer gastrointestinal side effects than regular metformin. They will also add berberine or dihydroberberine, and research indicates that these combinations can actually work synergistically, giving you the best of both worlds. Additionally, if you are just starting off, start with 500 mg of metformin with dinner only. If you are tolerating it well after a week, you may raise it to twice daily with meals. The truth is, you have options. The use of metformin is not your only option. You deserve to feel good while controlling your blood sugar, regardless of whether you decide to continue taking it under closer observation, switch to extended release, or add supplements like berberine or dihydroberberine or kidney and liver support. Don't be miserable, don't accept pain as the cost of being well, and do your own research. Your body is telling you things, pay attention to them. The healthcare system may have blind spots, but you can remove them, and the pharmaceutical sector may not put your comfort first, but you can. Your path to improved health doesn't have to be paved with having adverse consequences, because treating diabetes shouldn't need you to sacrifice your life. You're just told to live with it and take charge of your health now. Please leave a comment below and share this video with us. I'll see you in the next.